Serious, what is the most unprofessional thing a medical professional has ever said to you? When I was pregnant, the phlebotomist at the doctor's office told me to stop wearing my seatbelt because my brother didn't wear his and he got into a wreck and he would have died if he had worn a belt. Well, my aunt didn't wear her seatbelt and got into a car wreck and died because of it. My cousin who wore hers only got a few bruises. I guess the phlebotomist's brother and my aunt cancel each other out. 12 years old at summer camp. Had a high fever, nausea, and sharp abdominal pain on lower right. Other kids told me my skin and lips were really discolored. Went to the nurse. She does the hand on forehead, tells me to lie down in the back of the infirmary, then tells the counselor that I'm faking it and I'll be back out when I'm bored. Assistant nurse takes my temperature, 103, and starts having an argument with head nurse. I wake up in recovery at a hospital a day or two later. My appendix was gangrenous and had burst a bit. I worked at the same camp a few summers later and got into a conversation with the same head nurse, and she said that my acting almost cost her job. I just took off my shirt and pointed at the 8-inch scar. Wonder how many other kids she's almost killed. It's not like appendicitis. Along with other stuff you get at camp like Lyme disease, dry drowning, allergic reactions, and concussions, is shockingly rare in kids. I broke my femur when I was a kid, and when I arrived in hospital the doctor exclaimed that it was impossible that it was broken as it was such a tough bone and swore it was only bruised sprained. He then lifted my leg only to have it fold mid-thigh around his hand. I was rushed off pretty quickly. All bone can be broken is like the first thing you have to know as an doc. I was a newly minted EMT intermediate, the level between EMT and paramedic, and as such had just received permission from the state to intubate people. My partner and I get sent to a cardiac arrest along with another ambulance, the supervisor, a fire engine, and 2 cops. Pretty standard in my region. We were second on scene behind the fire engine, and my partner looked at me as we walked in and just said, "You've got the airway. Alright, game 1. I followed my training to the freaking letter, sized the tube, checked the cuff, visualized the vocal cords and the tube passing through, condensation in the tube, checked the number at the teeth, capnography, secured the tube, the whole shebang." One of the firefighters checked epigastric sounds, negative, left lung sounds, positive, and right lung sounds, positive. It was a textbook intubation, and since it was my first in the field I let out a celebratory yes accompanied by a fist pump. We were completely surrounded by family members. I would feel much better if an EMT were to celebrate the little things than if they were just to continue with what they were doing. I think you're a hypochondriac. While pregnant, I couldn't stop throwing up. My GP told me I was a hypochondriac and I was making myself throw up. I lost 40 pounds during my pregnancy and was finally hospitalized for hyperemesis gravidarum when I was 8 months pregnant because I was almost catastrophically dehydrated. Apparently that was just this guy's thing. He also told a friend of mine that she was a hypochondriac too. Turns out she has lupus. 2 hips and 2 knees later she's doing quite well. He can no longer practice medicine because he was caught sleeping with one of his patients that he had been prescribing antipsychotics for. A bitchy ophthalmologist's assistant kept yelling at me to relax, like that's gonna help, because my eye pressure kept reading high. Turns out I had high eye pressure. There is no way to relax when you're staring at a machine that blows in your eye. Well, this one might be somewhat comical in a distorted, "my god that was disastrous" sort of way. Honestly, I'm a little surprised it didn't show up on this thread already. Maybe it just hasn't been upvoted yet. Disclaimer: I am the medical professional here and I understand the severity of this slip up and that it may be less amusing to some. But do try to understand that those of us in medicine who encounter health tragedy fairly regularly must cope with humor at times. It's meant in a purely benign way. This is such a case. It was my first clinical rotation in medical school, OBGYN. I was on an outpatient week, seeing women who came in for their regular pregnancy checkups and the like. I had my doppler with me, that little microphone-like thing that we use to hear the fetal heart rate and the uterus. Well, my doppler battery was low, and I knew that. I enter the patient room, pleasant and professional, The pregnancy is going swimmingly and there's nothing but sunshine. I apply the gel to her belly and turn on the Doppler. The fetal heart rate is a beautiful 150 beats per minute, right where it should be. Then the Doppler runs out of battery. And what, pray tell, do you say when something runs out of battery? In a fantastic lesson in the importance of thinking before you speak, I reflexively blurted out, "Oh, it died." The high-pitched what that came out of this poor woman could have shattered glass for miles. In a panic, I explained that I was referring to the Doppler and ran to get a second one. Hearing the heart again, she was reassured that her baby was totally fine. Afterward, the woman took it surprisingly well and ended up laughing with me about it. Lesson learned. My god, even the most well-intentioned in bedside manner can slip up. I am a huge proponent of humanism in medicine because the doctor-patient interaction has dramatic effects on physiology and healing, let alone the impact it can make on the human experience in illness. Plus, well, it's nice to be nice. Serendipitously, I was later on my outpatient pediatrics rotation and that very woman came to my clinic with her beautiful, healthy baby girl. So the story ends well. Just keep in mind, we are humans too and can unwittingly be less than graceful. Enjoy the material. Larry David. Nah, this is a funny, well-intentioned, silly misunderstanding that was quickly and easily corrected. No worries. I had an appointment to set up a birth control pill prescription because my periods were complete heck and needed beaten into submission. The nurse who did my medical history got to the appointment reason and started TSKing and told me you shouldn't be here. You don't need this. Come back when you're having physical relationships. The freak? That's horrible advice. But the worst part was this was coming from a nurse at a clinic attached to a college, so you'd think that attitude wouldn't have lasted long. The actual doctor was awesome, but that nurse was an obnoxious, ignorant moron and I hate to think how many other patients she treated like that. That's also not considering that many people want to start birth control before being active in private life to limit pregnancy risks, even if you should still use a condom before you get tested. For me it wasn't so much what a doctor said, as what they didn't say. About 6 months ago I went into my general practitioner for a yearly checkup. I'd been having some weird vision problems, but other than that I felt perfectly fine. Blood work came back a few days later and I was told to come in and discuss. Okay, little worried now. Come in, talk to my doc, and he's got a big smile on his face. He hands me my blood work results. Almost every line item says it's either way above or way below safe levels, and tells me to frame it because it's the single worst blood test result he's ever seen. And it's obviously a lab error because if your blood was really this bad, you'd basically be on your deathbed, and you obviously look and feel fine. Few new blood work is drawn. I'm told to wait a few days and they'd let me know once the lab ran the tests correctly, but not to worry since lab errors like this happen all the time. A few days later I get a call from a nurse I'd never spoken to. You need to call this number right away, she says, offering no further details, and make an appointment with Dr. XXXXX. I was so taken aback that I didn't ask any follow-up questions. I just hung up and called the number. Voice on the other end picked up. Cancer specialists of my state, how may I help you? And that's how I learned I had cancer. When I was 15 I spent a few weeks in a psych ward for children. It pretty much sucked. We had no therapy and I saw a doctor exactly twice. My second chat with a psychiatrist, he asked me how's it going. I'm not a one to lie to doctors, so I told him pretty much everything. How I'm feeling worse than I did before getting admitted, that other patients have been aggressive and I'm anxious around them, and that I am considering committing suicide after I leave. The nice doctor said it was very good I was feeling that way, because the hospital is supposed to make us feel awful, so we see how good we have it at home. I was discharged 3 days later. What makes me angry is that half the patients were from abusive households and children's homes. Go ahead, tell them how much better they have it at home. Butthole. Oh my heart. That's terrible. Sometimes I feel like there's no group more universally readily dismissed than children, and we're all children. Once. I hope you're doing well. My wife and I had a miscarriage, and it required her to have the fetus removed via a D&C. Well, they used a vacuum type thing to remove everything, but didn't come close to getting it all out. It caused my wife to get an infection and she got really sick. She got brought back to the hospital to have a second D&C performed and the doctor said usually I just stick the vacuum up there and keep sucking until no more of your baby comes out, but it looks like we must have left some parts up in there. That doctor has zero bedside manners. When I was 18, I had a miscarriage. The nurse said should have used a rubber. I did. Thanks. Hey, if you're bored later you should take some of those pills and see the new Star Wars. My malefaxical surgeon after getting my wisdom teeth removes. Sounds like a good way to take your mind off any discomfort though XD. Here's how to shoot rubber bands like a professional, followed by many minutes of lessons, when he was already over an hour behind schedule. A nurse told my wife when she was pregnant that although it's against policy she would recommend not vaccinating our child when it was born. Made me freaking furious and of course we have had all the vaccinations done we calced. It's terrifying how many of those people work in the medical field. Ugh. When I was about 12 I had to go to the doctor for a cough. I had to take my shirt off so that he could listen to my lungs or something, and when he was done he just casually said to my mom, a bit of a late bloomer, referring to the fact that I didn't exactly fill out my training bra and had some leftover baby fat. Thanks doc, I wanted you to get rid of my cough, not my self-esteem. Adderall isn't for people with ADHD. It's for college students who need to study. After I told him I took Adderall, what? College student is an interesting diagnosis. Not sure how my insurance company would react to that. I went to the emergency room one night because a friend kicked my finger by accident and I definitely heard a snap. It was super swollen and really painful. Because it was just a finger I obviously had to wait for hours. Not much of an emergency. At one point I asked a nurse for some ice to help alleviate some pain. She rolled her eyes at me and said, I don't even know why you're here. Your finger is probably fine. She made me feel like I was wasting everyone's time. But I refused to leave. Got an x-ray done. Doctor said I was fine. Gave me a splint. Sent me home. A week later things still didn't feel right, so I went back. Fractured in 3 places, required emergency surgery twice, and a year and a half later I have no movement in my finger whatsoever. I've been to 3 surgeons and no one can help me. It also really affected me mentally. Now whenever I want to go to the doctors I always have this nagging voice in my mind like, but is it important enough? Are you wasting someone's time even though obviously I wasn't that night? My finger is hella fricked up. Went in for my first PAP when I was about 16. This doc was the same one that my mom and my sister used, and I was freaking out a bit after my sister told me horror stories to get me all worked up. Anyway, there I am, leg in the stirrups, staring at the ceiling, and trying my best to focus on the questions she's asking and not what was about to happen. She sticks her finger into my nethers, pulls them out and goes juicy. Now she didn't say it in a creepy seductive way, but more of a like strawberries. I died a little that day. When my son was born, we had a resident physician who'd assist the attending. She is a one-woman show. Not a single thing that came out of her mouth was professional, kind, compassionate or even remotely helpful. During labor she would routinely tell us the wrong information. Tell us my wife was more or less dilated than she really was. The nurse or attending would rectify this, and would constantly warn us that my wife was getting too sick to deliver and was getting into a dangerous zone with her health. The hospital we were at is a level I trauma center known for having a world-leading L&D department. Eventually, my wife had a C-section, and this resident would amp her up, listing off the possible complications, including death, brain death, paralysis, blindness, etc. It must have been 100 life-ending altering complications. My wife is in tears when the anesthesiologist comes in. My wife's blood pressure is through the roof, and the doctor asks what's wrong. Through her tears, she tells him. He loses his crap. He mutters mother sucker, then gives us a realistic picture of complications. Off we go. 0 complications and a healthy baby. Next day, resident comes in, almost at a full run. Bilirubins, panting off the chart. Panting emergency. So, she looks around for the baby. The baby is in with the pediatrician, who happens to be the hospital's chief of pediatrics. She's running down the hall trying to find the doctor baby. I'm going into a full panic attack. We had been having latching problems and the pediatrician was brought in for a routine checkup. I'm chasing her. She finds the pediatrician. This guy is in a golf shirt, slacks and is holding my son with a senior nurse. Neither of the two senior staff look the least bit worried, but I can't tell what's going on. She screams bilirubins and he says shut up. Turns out, his bilirubin was in the normal range. She had read the wrong file. It was for a little girl who was already undergoing light therapy and was due to be discharged. The nurse, who is Jamaican, grabs me and tells me to relax. She forces me into a chair, hands me some water and is patting my back. The chief of pediatrics lights up this resident. He goes off, telling her she's traumatizing patients and her behavior is unacceptable and that he's speaking with the resident director. So, the baby isn't going blind. I just sat there, shocked, horrified and shaking. As I write this, my son is tearing his toys to bits and randomly farting, then laughing. The best resident was this young guy who said, I'm young, I'm inexperienced, so if I'm managing your care, you should know that you aren't in any sort of trouble. The nurses and I report to your doctor and everything will be okay. I had my doctor at the time chew me out because I was leaving my newborn son with his dad while I went to a different state due to work for a few months. I just remember her raising her voice a bit and asking me who was going to watch the child. While I was gone, I gave her a confused look and just pointed to my son's dad who was sitting right next to me. She looked shocked and almost repulsed. Still pisses me off to this day, and she was also acting really confused why I was the one that wanted to work and not the dad. To those asking, the doctor was an old woman who seemed very old-fashioned. I was gone for 3 months but made enough money to where me nor the dad had to work for a while after that. I think being able to afford a roof over our heads is better than breastfeeding and not having rent money. You would think a female doctor would understand the concept of a woman with a career. When a panel of Air Force Base mental health counselors told me my then husband was only abusing me because I don't support him enough and if I would commit more to cooking, cleaning, and fricking him, he would be able to relax and stop abusing me. Had a small but annoying cyst removed. Afterwards the doctor asked me if I have accepted Jesus Christ as my savior. I got a perturbed look and said of course just to defuse him. He also tried to hand me some pamphlets, churchy cartoon Christian soldier looking things, so I did not think he might be reacting to some deadly horror coming out of my back along with the sebaceous cyst. Had a huge swollen gland under my arm, looked as big as an egg. My family doctor's eyes got just as big when he saw it. Sent me to a specialist. The specialist said you either have lymphoma or an infection. Then he walks out of the room without another word, leaving his assistants to tell me to come back if the giant swollen gland under my arm doesn't shrink. He was just so matter of fact with no bedside manner. Luckily it wasn't lymphoma. You're too young to have endometriosis. No, I'm 31. Of course I'm not too young for this. That doesn't even make sense. Idiot was aware I'd already had surgery for it too. Then he went on to suggest that I was selling my painkillers. When I laughed that off, he said maybe my boyfriend stole them from me. I stopped laughing and just was like, are you freaking serious? Go frick yourself. I wasn't there for pain meds, BTW. I had an eye infection. He just wanted to lecture me. He can go frick himself. I had a hole in my ear and that healed. Why don't you give it some time? If you get hearing aids you will just be reliant on them. I've had a hole in my ear and been hard of hearing for the last 25 years. Same practice, different doctor. Well, are you sure it isn't AIDS? That would affect your immune system. Since she found out I was B, everything was AIDS with her. Sore throat, AIDS, ear infection, AIDS, arthritis, AIDS. She was very polite about it. She was just absolutely convinced I must have AIDS because my medical history included fricking with men. At the time of several of these, I had recent HIV tests on my chart. Because I have a chronic illness, shockingly, an immune condition. You know, one that might affect my immune system. So when they run off with tubes of my blood I get all the bonus tests done because you might as well. I had a doctor swear I had herpes because I was vomiting and experiencing extreme stomach pain. She reported it to the health department and everything. Had to have emergency gallbladder surgery a week later and my herpes was magically cured. The health department sent me stern letters for years demanding I report my physical partners. I hit my head and was bleeding. When I went to the hospital, the doctor was really nice until he found out I was on workers' compensation. After that he was pretty cold to me. He didn't even check me for a concussion. He just cleaned the wound, stitched me up, and sent me away. I hit my head while at work, so my company's insurance was to take care of it. For some reason, that made the doctor completely uninterested in helping me. When I say he didn't check me for a concussion, I'm not talking about an MRI or anything really technical. One of my co-workers checked if my eyes were dilated and I was coherent right after the incident, so I wasn't too worried. But that's basic first aid stuff and he's not a professional. I figured a doctor would check, do the flashlight in the eye thing, ask if I was woozy, check my pulse, something. The doctor literally just cleaned the wound, gave me stitches, and sent me away. I was lucky I didn't have a concussion because if I did the doctor probably wouldn't have noticed. I could have passed out the minute he walked away. I've had head injuries before and have taken first aid classes. And this doctor just seemed so unprofessional about treating me. I'm not asking for special treatment or first class bedside service here. Just do it by the book. Ugh. A dentist. I went in for a cleaning and had another appointment to take care of a wisdom tooth. You're fat. You know that? Your teeth wouldn't be so bad if you weren't so fat. God, you Native Americans are also fat. Let's discuss what's worse. How visibly uncomfortable dental technicians, who are all natives. The fact the clinic was exclusively for my tribe. The way off color remarks she made later about tribal members being poor. And how she was better than this. Or perhaps the fact she just insulted the medical director's grandson. It's really sad because they had trouble finding a dentist. Because we are a disgusting people, I guess. But she magically found a job in Florida the second time I was there. She wouldn't shut up about how she was leaving for this great job in Florida. She bragged so much it seemed almost unbelievable. Almost like it was a total lie and a xenophobic bee was losing her job. I should have called her out. But I'm sure her techs already knew. If you have to brag about moving to Florida, your life is pure crap. I was probably 16 or 17 and went to my first OBGYN. The doctor's small talk was, "Oh, I see you don't have a fur coat," because I was clean shaven. Never had a male OBGYN after that. I went in after getting bit by a stupid cocker spaniel because the hand it bit was inflamed and it looked infected to me. The doctor, after looking at my hand, just casually goes, "Oh, by the way, your haircut makes you look like a dude. If you didn't have breasts, I'd have asked you if the info you gave us was correct." I'd shaved my head a couple weeks before as a show of solidarity with my cousin who had cancer. I was too shocked to say anything and he just left the room. Butthole. I asked a nurse midwife for information about getting my tubes tied. Her response was, verbatim, "Are you sure? Don't you want to have just one baby? Just to see what it's like, as if there's a 90-day return policy?" Haha, when medical professions stick their own opinions into stuff like this, I love to mess with them. I'd honestly have said that back to their face. Especially older generations, it seems, have a hard time accepting alternatives to the norm. This past week, I took my two daughters, 15 and 17, to Johns Hopkins Pediatric with extreme pain. They both have been diagnosed with a form of dysautonomia called POTS. They each have a cardiologist and a neurologist at Hopkins, and I communicated with these docs and went to the ER at their suggestion. The resident told my 15-year-old to suck it up and deal with the pain. My daughter started to cry, and the doc just stared at her. The attending questioned the meds that the neurologist prescribed for my 17-year-old and told her they wouldn't work on her kind of pain, and felt the need to contact the neurologist to personally speak with him before she would consider preparing the IV. When my daughter explained the level of pain she was experiencing, the doc told her that they don't have pain meds other than Advil and Tylenol. When she came back in an hour and grudgingly said she would give her the IV, my daughter was so frustrated that she said she'd rather just go home. She's terrified of needles, and once she had an hour to think about the doctor's comments that it wouldn't work, she wasn't willing to do it. Their specialists were furious when they heard how they were treated in the ER. "We think that because I came in with both of my daughters looking for pain relief that I was after drugs for myself. Unfortunately, I cannot control if my children's flare-ups coincide. The cardiologist has since offered to give me a letter to carry for each of the girls to certify and explain their medical issues. Just to clarify, I love Hopkins and their peds. We have been extremely satisfied with the level of care my girls have received in the past. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.